Atypical pneumonias of the upper respiratory tract are organisms that can lead to particular types of pneumonias, but we don't typically see it as a disease organism commonly in the population. Atypical pneumonia sometimes will be developed in patients who are hospitalized or in special types of conditions, maybe immunocompromised and pick up infections that are not commonly seen. Pneumonias typically have a bacterial etiology. If bacterial agents are not isolated in the pneumonia, they're considered to be atypical. Most common atypical type of pneumonia that presents is mycoplasma pneumonia, which is not grown on a routine isolation medium. The bacteria can be grown and isolated in horse serum, use specific extracts from yeast and or eggs for organisms to grow. The disease kind of presents itself in an indolent form. The person may have a subacute presentation, and so the individual may be able to walk around, carry out normal activities. We refer to that as a walking type of pneumonia, walking pneumonias. Tetracycline, though there are a number of other drugs, but generically speaking, tetracycline can be very effective in treating this organism. Mycoplasma pneumonia, pleomorphic walls of cells, bacteria. That's a nice EM produced by your textbook. Also called primary atypical pneumonia or walking pneumonia, common in children and adults, and diagnosed by the polymerase chain reaction that we talked about before, or by using or measuring IgM antibodies. And mycoplasmal pneumonia, again, this is the electron microscopy demonstrating that. In legionellosis, we've talked about Legionnaire's disease before, characterized by high fevers and cough, caused by gram-negative rods, Legionella pneumonalia. The bacteria may grow in water or in air conditioning systems. The commonly reported case was from the 1960s, 70s, where a convention was going on. What is it, the Legion or something organization? It's a big-time organization. Legionnaires, anyway, met together. They met in a hotel room. The air conditioning system in that hotel was contaminated with this organism. They inhaled the bacterium and developed a series of pneumonias. Multiple individuals that were there were infected by this. Can be treated. It's erythromycin and rifampin are drugs of choice, also called a mild and self-limiting disease, also referred to as Pontiac fever. Cetacean birds basically are birds such as parakeets. They lead and can produce a disease called staphylococcus. This organism, again, gram-negative and can lead to significant pulmonary infection. You can see cells will develop we call them reticular bodies, or little inclusion cells inside the cells, and eventually will become organisms that will cause tissue destruction. You can see it or get it picked up from the dried bird droppings of sick birds, which are typically the source of this disease. Chlamydia pneumonias can be seen as well. Chlamydia, the same organisms that can cause infections in other parts of our bodies. We can see outbreaks of these organisms as well. Resembles mycoplasmal pneumonia, can be transmitted from person to person. Coxella burnetii is an obligate intracellular parasite that leads to a condition referred to as Q fever. It's a parasitic organism. Cattle ticks eventually will contaminate dairy products. Can't get off the dairy products today. An occasional complication is endocarditis, and in special cases, again, leads to Q fever. Staph aureus, Mycoplasma catarrhalis, we talked about, and Strep pyogenes, we've talked about, Klebsiella pneumonia, and Pseudomonas species as well. All of these can cause other forms of bacteria, but would be atypical in presentation. Legionella, just as a review, we see this transmitted from moist environments, inhalation of aerosol contents, air conditioning systems, almost exclusively found in water. Not usually transmitted from human to human. Usually the source has to be from some other type of moist environment. You can culture bacteria to make the diagnosis, and treatment can be with erythromycin. Chlamydia, also gram-negative intracellular organism, transmitted by bird droppings to humans. Again, will form reticulate or inclusion bodies inside cells that are being phagocytized. You can culture it, takes a special cultural medium in the egg or a cell culture. And then treatment with tetracycline, which is a very common agent and generically provided antibiotic agent that would be able to rid that. Chlamydia pneumoniae, transmitted from human to human, in treatment with this is with tetracycline as well. Mycoplasmic pneumonia, which again, Q fever, very atypical, common in children, young adults, and usually the polymerase chain reaction can be used. It's a very rapid test that can be used now for the diagnosis of various microorganisms. For viral pneumonias, viruses that can attack the lower respiratory disease, very difficult to confirm viral infections. Individuals with viral pneumonias can come in, go into frank respiratory distress, be on a ventilator for prolonged periods of time. You'll obtain multiple cultures of blood, multiple cultures also of sputum, and all the cultures will come back negative. And it's a diagnosis of exclusion. You rule out any fungal element, you rule out any bacterial element, and if all of those studies come back negative, then you make the, it gives you the impression that the person was infected by a viral agent, and thus the diagnosis viral pneumonia. Respiratory syncytial virus, common in children, has a significant mortality rate. Again, viral infections that attack the system. Viral pneumonia can have complications with influenza, measles, and chickenpox. The chickenpox, not smallpox, chickenpox. Viral etiology is suspected, but no real cause has been determined. In respiratory syncytial virus, you see 4,500 deaths annually from this disease. Symptoms include coughing. There are testing that can be performed, and ribavirin is the treatment of choice. For influenza virus has a coat. And one of the reasons why it's very difficult to treat all of the influenza viruses is because multiple viruses have multiple different coats. And so because of that, antibodies against these attacks from viruses cannot be produced synthetically. Antibodies have to be developed inside our own system to be able to attack these types of organisms. Variations in their composition alters the antigenetic type of the virus. Basically what that means is our immune system recognizes a specific coating, specific type, and knows to attack that specific organism. However, in organisms that can change their coating from season to season, or even within a season, can change its coating or change its appearing, then our immune system can't attack and can't work on those various organisms. So one of the problems in developing a vaccine, I develop a vaccine for type A, type B, well, you get infected with type C, so the vaccine doesn't really help you out and you still become sick. And viruses can do that. They can mutate and change. The term antigenic drift is a result of a minor variation in an antigenic group or makeup. Antigenic shifts are major changes involving recombination of the RNA structures of the genome. Vaccines are available and are given to high-risk groups. Again, they don't provide 100% guarantee that you will not get pneumonia. You won't get pneumonia, you won't get the influenza virus. Now, you won't get the major types that you were vaccinated against. If you got vaccinated for type A, type B, you probably won't come down with type A, type B, but you may come down with type M or type N or type O or whatever the antigenic drift has been, whatever the new appearance of this organism has been, that's what you can potentially get infected by. There are a number of antiviral agents out there, and again, I've listed them for you. Zanamivir, Relenza. Relenza you may hear a little bit. Amantadine you may have heard about before too. Tamiflu for sure. Some of the others I don't think it's important to mention because we just don't see them commonly used enough. Some symptoms include chills, fevers, headaches, 1% mortality rate a year, typically related to that. Amantadine, treatment of choice. You can do a hemagglutinin test. Basically, these viruses will make cells clump together, and so you can actually do that type of a study to help identify the organism. And this is just a review of what we already stated. The antigenic drift, changes in the spikes or the appearance of the antigen makeup, probably due to genetic recombination between different strands that infect cells. Coccidiomycosis, these are another type of organism that can infect the lower respiratory system. This is a fungal infection. Coccidioid immitis is basically an organism that's found in the soil in southwest America. It causes coccidioid mycosis. Treat it with a very tough antifungal agent referred to as amphotericin B. Amphotericin B, what do we call it? Amphotericin B is another name that's used for it in the hospital because it causes significant abnormalities in fluid and electrolyte. It can also cause some problems with the liver or inflammation of the liver related to the use of the antibiotic for treatment or the antifungal for treatment of the fungal infection. You also see amphotericin used in cases of sporotrichosis. Remember we talked about sporotrichosis, rosebud disease, rose gardener, picking roses, gets punctured with the thorn from the rose and gets a significant infection. Amphotericin is one of the agents that's used. The person needs intravenous treatment. Histoplasmosis is caused by fungus as well. Histoplasma capsulatum resembles tuberculosis. It's seen mainly in areas such as Mississippi and Ohio river valleys. Bird droppings in soil encourage the growth of fungi and spread in airborne. Amphotericin B and itraconazole can be used as treatment. Another organism that you can see that causes pneumonias is pneumocystis carni pneumonia. Pneumocystis carni pneumonia, very common in, well, not uncommon, I shouldn't say very common, but not uncommon in individuals with HIV disease. Pneumocystis jirovecii is an organism that got its other name. Again, we refer to primarily as pneumocystis carni pneumonia. The parasitic may be transmitted by human contact, cause of disease, again seen particularly in patients with autoimmune disease. I have seen it in patients that were receiving chemotherapy who are also immunocompromised. Pneumocystis infections cause the alveoli to become filled with frothy fluid. Untreated infections typically are fatal. Remember, if the alveoli become filled with frothy fluid, you can get no air and no gas exchange, and so the reason why it causes significant problems. And on a chest x-ray, where the lungs are clearly visualized, on a chest x-ray of someone with pneumocystis carni pneumonia, you see these fluid-filled layers on all of the tissue of the lung, which leads to very severe respiratory compromise. Histoplasma capsulatum, another fungus that can be seen in the system. This is just a chart demonstrating to you the frequency and what areas of histoplasmosis in response to amphotericin. Coccidioid also has a life cycle that feel free to review. Basically, organism goes through various stages of division, developing eggs, and then releasing into the human organism. This is a distribution again in the southwest where we see coccidioid mycosis and pneumocystis carni found in healthy human lungs. The pneumonia occurs when newly infected infants or immunocompromised individuals. You treat these individuals with sulfa drugs. Trimethoprim, sulfamethoxazole is a treatment of choice at higher doses, typically much higher doses than what we typically give for individuals who may not have this type of opportunistic infection. Another organism is Blastomyces dermatitidis, and we see causes of blastomycosis in the United States, often found in the Mississippi Valley, although most cases are subclinical. Progressive infection, you can get cutaneous ulcers from it, again treated with amphotericin B. Blastomycosis, another organism that can be found, as we already said, extensive tissue destruction and requires amphotericin to be able to treat. Another type of fungal infection as well is aspergillus, leading to aspergillosis. You can see this in compost piles. It's mold genre. It can cause pulmonary infections in susceptible individuals. Typically, a degree of immunocompromise has to be going on with these individuals as well. The only case of aspergillosis I saw or have seen has been related to someone who already had underlying lung disease. These are other infections that opportunistic Aspergillus rhizopus and